If I get closer, I won't have to get louder. Well, good morning. Greetings, everyone. I'm Steve Meyer, the President and CEO of the YMCA. Thank you for being with us for a few moments this morning. In just over the course of the next few minutes, I want to spend some time and do these three things. A welcome, some reminders, and then a big, exciting, important announcement to us. So by way of welcome, we're really happy to have with us some of our YMCA board members, some Y staff, some long-serving partners, and partners that we've been programmatically aligned with for many years, including Covenant Health and Saginaw County and the Saginaw ISD and Saginaw County CMHA and the City of Saginaw and Saginaw County. So thank you. Also want to welcome our new partners. When we get to the exciting announcement part of you're going to hear more from them and about what we're announcing today. By way of reminder, it's interesting, we are here juxtaposed between the Wellness Center and the pool at the Y. Across the country, people know and identify the Y as this great gym and swim organization that's been around for a long, long time. We want to remind you or let you know that the Y is so much more than that, so much more than the gym and swim. So we are a cause-driven charitable organization. Our mission, if you will, our mission is to improve lives and strengthen community. We do that through programs centered around youth development, healthy living, and social responsibility. I want to make a couple more reminders. Last year, 2018, we had a couple significant milestones. We surpassed our 150th year of serving our community here in Saginaw. Pretty big deal. So if you think back Thank you. We had a great road show most of the year last year, and the Y's just enjoyed this beloved place in our community. If you think back, though, we are not your grandparents' Y, and we're not your parents' Y. In a lot of cases, we're not the Y that you knew 20 years ago or the Y that you knew 10 years ago. We're continuously innovating. We're a very comprehensive organization, but we're very nimble as well. So our goal is to meet our community's needs where the needs are greatest. And again, it speaks to the partnership and new programs we're announcing today. The other big milestone I'll remind you of is during the course of 2018, our 150th year of service here in Saginaw, we completed a major capital campaign called Kids Campus. The Kids Campus campaign is a joint venture with our partners across the other side of the parking lot, Boys and Girls Club of the Great Lakes Bay region. And together we raised over $4 million to make facility and program enhancements at our Camp Timbers facilities up in West Branch, the former Junior Achievement Building across the parking lot, and we're in construction mode right now here at the Y. Even as we speak today, we're on the final third leg of our project together. And so that continues to advance our work and again speaks to our partnership. Along the way, while we were getting that up and established, we have now some new partners that have come on with us. We offer an alternative high school with the Saginaw ISD here, hosted at the Y. Starting in April, the County Commission on Aging will be moving in for one of their friendship centers, which is a lunch program with access to the rest of the amenities here at the Y. And we will welcome Renew Physical Therapy into our building, as well as other partnerships that we keep exploring. So that puts me right into this, just a quick reflection. The community, therefore, demonstrates in us a lot of trust and a lot of confidence in investing to keep our Y strong, your Y strong, and really expects from the Y that we lead, we convene, and we solve problems. So that gets me right to the point of today's announcement. Today we want to announce some new programs, some new offerings on our already robust menu. These are evidence-based health initiatives, which means you're going to hear a little bit more about if we follow the script, these programs get the results that are desired. And so the programs that we're really excited to announce today is we will be hosting a Healthy Weight in Your Child program, Live Strong program, Live Strong at the Y, and blood pressure self-monitoring program. These are all evidence-based national model programs. We're able to do this with new partners and our friends from Central Michigan University School of Medicine, and Mihiel. So I want to thank our newest partners, CMU and Mihiel. You're going to meet and hear from them in just a couple minutes here. One more request, and that is for those of you who are providers, that we ask for your referrals to our new programs here at the YMCA that I just mentioned briefly. And also those individuals who are out there, you know these programs, if you may benefit from them, we're here for you at the Y, and please contact the Y to learn more. So I'd like to welcome now, we're going to hear from Beth from Mihiel, but first from Dr. Lou from CMU.
Good morning. I am Winnie Lou. I'm a physician at CMU, Central Michigan University. So as one of the largest providers of primary and specialty care in mid-Michigan, can you guys hear me? Yes? Speak up. Okay. So as one of the largest primary and specialty care providers in mid-Michigan, CMU recognizes the impact that a well-structured exercise program can have on our patients and on the community in general. So we're so excited to partner with the YMCA and happy to refer our patients to some of these evidence-based programs that the Y is offering. So I am a sports medicine specialist, which means I specialize in diseases of the muscles, bones, and joints. But I'm also a primary care provider. And I get very frustrated because a lot of the chronic disease I manage can be treated with exercise, and in some cases even completely prevented with exercise. You know, we all know that high blood pressure and heart disease you know, can be treated with exercise, but we often don't think about cancer, depression, dementia.
Sorry.
Felt like I was yelling. Hello? Hello? Is this better? Okay. All right. So I won't start from the beginning, but so you know we know that heart disease and high blood pressure, all of these things are closely related to how much we move, but we often don't think about things like cancer, depression, dementia. You know, there are 13 cancers that have been linked to exercise or lack thereof. So exercise can decrease your risk of 13 different cancers. Decreases your risk of dementia. And exercise has been shown to be as effective as some antidepressant medications for the treatment of depression. You can decrease your risk of heart disease. So heart disease is the #1 killer of adults in the United States. You can decrease your risk of heart disease by half just by increasing your fitness levels. It's been shown over and over that fitness levels are highly predictive of your overall risk of death. They're even more predictive than your traditional risk factors such as cholesterol, high blood pressure, and even smoking. So being fit is more important than not smoking, having good blood pressure, good cholesterol. So that being said, and we're really excited to have these programs. It's a great resource. So we have a problem in Saginaw. Last year, in 2018, we earned the distinction of being the fattest county in Michigan. So the obesity rate in Michigan sits around 30%. In Saginaw County, we're at 39%. So #1. Not something we want to be #1 in. So our adults are obese, our children are more obese as well. And this is a problem because obese children become obese adults. And obese children are at much higher risk of developing chronic diseases at an earlier age, so high blood pressure, even arthritis, asthma, all of these things at an earlier age. So it's also important to develop these healthy eating habits, healthy moving habits early on in life. So the WISE Healthy
Weight in Your Child.
Healthy Weight in Your Child program is definitely a great resource to get the family involved, and getting the family involved will definitely help make these changes stick. The blood pressure monitoring program will be a great complement to the traditional office-based care. You know, they show your patient how to monitor their blood pressure on their own. They provide nutritional classes, so it'll definitely be a great complement to what we do in the office. As we get older, we lose muscle mass. This is just nature. And it's been shown that this loss in muscle mass can be really dangerous. You fall more. Your outcomes when you have cancer, any sort of heart disease, the less muscle mass you have, the shorter your lifespan is, the poorer your quality of life. So this loss of muscle mass is a really big problem. And the Y does have a couple of programs for older adults that help maintain this muscle mass, and they work on balance and all of these things. So these are just a couple of things, a couple of the programs that the Y is providing, and I would invite providers in the Great Lakes Bay region to in referring all of your patients of all ages to these programs. They're a great resource for the community. Thank you.
I'm going to try this without the mic. Can everyone hear me okay? Okay, perfect. I'm Beth Rosaticky. I'm CEO for Mihiel, also known as Michigan Health Improvement Alliance. We've been in this region since 2007 with the focal mission of creating a community of health excellence. And this is on the premise of 4 proven elements, a combination of them, of quality of care, cost of care, population health, and provider well-being. And this combination, when implemented well, will create a community of well-being. Our vision is really following the collective impact model, that we are going to achieve a healthier community across multi-sectors and across multi-stakeholders. This isn't just about CMU Health Partners and their primary care physicians. This isn't just about what the Y can do. This is about what each of our organizations can do to help move the needle in these areas. There were some great statistics shared. To build on that, we also have one of the lowest access to opportunities to exercise in the state of Michigan. The county of Saginaw is at 65%, and the state of Michigan is at 86%. We have a lot of room to grow. With that said, we're making some great strides in some health indicators, such as access to food, as well as affordable housings. Those are the foundations of how we can continue to build a well-being community. You made some great points about improving life and social responsibility. This is not just a swim and gym. This is about a wellness hub. And this is about creating well-being across our communities and really being able to act as a conduit of what health and well-being means. The 4 programs, the evidence-based programs that are being launched today, these initiatives are wonderful. They are definitely ways to move these statistics and to help us move in the right direction. I will say that this is the 1-2 punch. There's a lot of other community programming that can be partnered with Live Strong, with blood pressure monitoring, the healthy weight in your child. So if you are a non-clinical organization, remember these 4 programs, but also remember how within your organization, how you can link to these. So the call to action, I would say, from Mihiel today is we need to partner across our sectors to continue to improve health of our communities. That said, we'll turn it over to Michael. Perfect.
Thank you very much for those great comments, and I'll try to piggyback on those comments a little bit as I make my comments just to kind of wrap things up and close us out. I'm Michael Webster, chairman of our board here at the Y, and also chairman of the Saginaw County Board of Commissioners as well. And I'm excited to be here today for this opportunity, and we don't do enough of this in terms of celebrating the wonderful work that we're doing here at the YMCA, but also I'll talk a little bit as well in terms of the partnership and the collaboration that's brought about through all of this. Before I do that, though, I would like to highlight and recognize some of our past chairmen of our board here at the Y and ask those gentlemen to stand up. They are here, and they're current members of our board as well. And they are here, and I'm begging them to stand up, and they are here. Past chairmen of our board, they are here. Dr. Jack Nash and Joe Pickler, those are past chairs of our board here at the Y. And then also I'll ask one more individual, very special to this community, and that's our mayor here in the city of Saginaw. I think he's here somewhere. Maybe he could stand and just wave. Yes, there he is. And I would certainly be remiss if I didn't recognize our new undersheriff for the Department of Sheriff here in Saginaw County. He's here. He's already standing, and that is none other than Mihiel Gomez, our undersheriff. But let me continue on. So it's been said in regards to the YMCA here in terms of the role that we play here, and it is an incredible role. About a year ago this time, we had an opportunity, as Steve recognized earlier, to celebrate our 150th anniversary here in this community. And we did it about a year ago this time at our Saginaw County Board Chambers. And in doing so, we did a proclamation for the YMCA here. And in that proclamation and in the comments that I made a comment that the Y is a gym in our community. And I was aptly and very aptly corrected by our president and CEO, Steve. He indicated, no, we're not a gym. And I think it was referenced just earlier, is that a lot of people think about the Y as a swim and gym institutional organization. But I'd like for you to think about it in another way. Would you rather be a gym, or a jewel? Think about it. Would you rather be a gym, or a jewel? Now, a gym is a place in which people come and they do athletic competition or just convene from an athletic standpoint. That's GYM. But if you think about also a gem, and this is something that may be a semi-precious stone, GEM. And some people would call then a gem as something really nice to have. But a jewel, and this is what Steve had corrected me on, he said, we're not a gem, we're a jewel. And he was right. We're a jewel in the community, because a jewel is something even more elevated and higher than a gem. We are a jewel. And a jewel is something very precious. It's a precious stone. But I'm reminded that a jewel becomes a jewel because of the artisan efforts to craft something very special and also unique. And that's what the Y here in Saginaw is. It is a jewel. We are very, very special. We're like none other because we are very unique in terms of our services and our capabilities and all that we provide through the partnerships that were just talked about. We are seriously that. We are a jewel in this community. And I think there are a lot of people, and as you can see here, that recognize the fact that we are more than just a gym and a swim. We are a jewel in the community. It's been said, and I think Shirley Chisholm said this, that the rent that we pay for our time here on earth, is our service to others. And that's what we see here at the YMCA, is a lot of committed people providing a lot of great services through our programs and through our partnerships to others. And I think that was well detailed in the comments that were made here. As we think about the obesity rates and we think about how Saginaw then is really kind of at the bottom of the list in terms of health for the state of Michigan, the solutions are provided right here in the YMCA. And Steve pointed out a key word. We are that convener. If you think about any other organization in our community, we are the ones that convene. We convene in so many different ways, from a social responsibility standpoint, from an athletic standpoint, but more importantly, from a health and wellness standpoint. We do the convening in our community. So I would invite you, and I'm glad you're here this morning, but I would invite you to become more committed to our cause here at the YMCA in terms of supporting our partnerships. We have a number of different fundraising efforts throughout the year, whether that's our capital campaign or whether it's our annual campaign as well. And keep in mind that those efforts go to strengthen our capabilities, they go to strengthen our programming, and then they also go to strengthen our community through the wonderful scholarships that we provide, so that others then have opportunities and access to take advantage of what we have to offer here at the YMCA. So again, just wrapping things up, I'm delighted that everyone's here this morning. This is certainly a worthy cause, and I can see that you are all committed to our cause and our mission here at the YMCA. So thank you very much.
Well, thank you, Michael, and that concludes our press conference. I would like to recognize that we do have a legislative aide here from U.S. Congressman Dan Kilde's office as well. Thank you very much. And those of us who spoke will be around after to answer any questions that you may have in follow-up. Thank you.